this. Hey, everybody. Thanks so much for inviting us to come and talk with you all. Lauren and I are going to share a bunch of these for a really long time, and we're going to just talk through our journeys, which have been really different in vet med, and give you a feel for what you need to do to establish your externship. We try to streamline that and make that easier for you. And then Lauren's going to get into the fun stuff like once you graduate, how do you integrate into a team, or even that could apply to your externship as well. You know, how to like put your best foot forward in a team, because it's virtually, it's an interview when you're interning. You know, you're showing them who you are and you're learning who they are. So I'm going to try and share this presentation. Bear with me. Oh boy. Okay. All right. So sorry you have to see me start the slideshow. I'm not very sophisticated. Okay, hopefully it shows on the right screen. Okay, I think it does. So if you guys haven't already done this, if you wouldn't mind just scanning that QR code.
So we can't actually see what you just shared.
Oh no, you can't. Okay. What can you see? Can you see anything?
I can just see you.
Just me.
Just
Okay.
you. Your background's blurred.
You as well, Maria.
All right. Okay. I think I have one more step I have to do. Oh, I know what I have to do. I have to actually share it.
Sorry, we
That's-
use Teams as a platform, so we need a little.
That's what I have to do.
Oh, now
Okay.
I see the things.
Okay, so I'm gonna slide this over here. Sorry, guys. Again, I'm so glad you're recording this. We just, okay, how about that? Can you see that?
Yes, perfect.
Okay, awesome. So if you haven't already done this, if you could scan that QR code with your phone, and that just lets us know who's participated, and that helps us with our team, so we can get a feel for how many students we've talked with. So I'll give you just a second to do that. Lauren made it with a cute little dinosaur. She has to show me how to do that because that is adorable. I love it.
The
Okay.
machine did that. Yeah, I wish I was that crafty.
Who did it?
The machine. The machine, I click and it just does it itself.
You have to show me how to do that. The machine doesn't do that for me. Okay. So we'll start with, who am I? This is me. I am that dork in the center there. I wish you could see, because I had like, Scrub used to have like stretchy, like they almost look like sweatpants on the bottom, and then I had huge scrunchy socks. It was a good look. It was nice. And there's a massive scrunchie in the back of my hair. That was early 90s. I graduated SUNY Canton in 91. I started vet med in high school, so I was a kennel worker and a receptionist, and then I went to SUNY Canton. I wanted to go to Delhi, but that's a whole other story, but Canton was great. And then I graduated and started at a GP location. It was not a great experience, honestly. That first job, the owner was not a nice dude, and I got really discouraged, and I was like, I don't even know if I want to be a tech, because it was just a really toxic environment. I was fortunate. I ended up leaving, getting a new job, and found a team that was amazing. And I ended up staying with that hospital for many, many years. And at that hospital, it was a great environment. It was a growing practice. When I started, there was 3 doctors. At its height, we had 16 doctors. I became kind of, I don't know how it happened, but I became the head tech. And when I was the tech supervisor at the most, I think we had 40 technicians. So it was a huge group. And then I became the hospital manager eventually. Realized I am a tech. I don't know what I'm doing. I have no clue about financials. So I started to pursue my CVPM out of desperation, because I just didn't understand the financial part of it. I didn't get P&Ls. I didn't understand all of that. I started that journey of trying to understand what practice management was and, kind of pulling together the people part of it and the financial part of it. I eventually became, well, let me backtrack. My hospital then was acquired by VCA, and I got an opportunity to be a regional manager, which that was after 10 years of being a hospital manager. Again, jumped into that not really knowing what I was doing, like just was like, I have an opportunity, I'm going to try it. And I had 15 hospitals that I oversaw, kind of in the tri-state area and like bits and pieces of Pennsylvania. And that was a completely different job, but gratifying. I learned a ton, and I did become a CVPM during that time. I took the test twice. I got to look at it the first time, and then I took it again 3 years later. It was a tough test. And then after several years working as a regional manager, the position of talent acquisition opened up in New York and New Jersey. And it was always one of the favorite parts of my job was to deal with new hires, to, kind of lean into the relationship part of vet med. And it felt like such a good fit. And I've been doing that ever since. It's been, I think, about 3.5 years. So awesome. I work virtually. Like it's really cool. I have such an awesome group of people that I work with. The reason I bore you with this background is just to let you know that, everybody's journey is a little bit different. And at no point, I'd like to say that I had a path that I said, okay, I'm going to graduate and this is what I want. I totally didn't. I just was I was in a great environment, and that made me feel confident enough to try things that I hadn't done before. So if there's one thing you could learn from my journey, it would be, don't settle to be in a location that isn't meeting your needs, that isn't supportive, because there's too much opportunity out there. And when you're in a great environment, you can do lots of different things and end up where you never thought you would be. So that is me. Does anyone have any questions about that bunch of rambling at all?
I am not seeing any questions.
Okay. I know that you guys do have, like part of your curriculum can prepare you for the CVPM. And if anyone is thinking about that, ultimately, I realize that you guys are in your first year, but if you, definitely keep my info, I'm happy to talk you through it. It is a little bit of an overwhelming journey. So if you need some support, I can certainly help. All right, so we're gonna switch gears and talk about externships and what that needs to look like. Kind of boring stuff. I don't know how much you dove into this. What's cool about VCA is we really try to help the students with the placement process. So you don't need to touch base with the location. You don't need to call hospital managers and hope they call you back. You need to know what you're looking for. So that would be the first thing. And I'm sure that you would do that with your advisor or your teacher or whoever helps you set that up. And think about some key points like, how far am I willing to travel and what skills specifically do I need? These are good things to have in mind because you ultimately will be talking to the team and they want to know how they can integrate you into their everyday. So just kind of have, even if it's, I'm guessing you're going to have a list of skills, so that'll be the easy part. But pull that stuff together. And you literally go on our career site, and it's vcacareers.com. And at the very top, I should have edited this slide because this is a little outdated, but at the very top, it says students, and you click the drop down, and one of the choices is vet tech or assistant. And it'll ask you to apply there, and you'll fill out all the pertinent information. And you can even put notes in there, if you have a specific location that you really want to make sure is your top choice, you can write that. There's like a free form section to it. It should take you like 5 minutes to do it. And once you do that, we have an extern coordinator. Her name is Amanda. She is totally cool, really awesome, very good at her job. She has like a huge master calendar that shows her what locations can take students, and she does the matching. So she will take your application, she will reach out to you, she'll reach out to the hospital, and she'll get you guys together, and she'll help you take that first step. And she's very quick, so she'll reply really quickly after. I think she usually says give her 24 hours, but you'll hear from her very quickly. And then the conversation is between you and the hospital manager. Usually, sometimes it might be the tech supervisor, kind of depends. But she'll set that up. And that's where I would definitely, once the hospital says, yes, we can take a student, you're gonna get in for sure. But I would enter into that conversation with some information and some questions for them too, to make sure that you want to spend these hours with this team. And you want them to see that you're prepared to take these steps in your education. So, you know, I mean, basic things, but ask them to give you kind of an overview of how they use their technicians. Every location is totally different. You know, they might rotate their techs through different disciplines. They might have everybody do everything. It really varies. Get a feel for if there's any special services that they provide. There are some hospitals that do some cool stuff that, in addition to the regular stuff that you have to learn, you know, there's some hospitals that have orthopedic surgeries that they do, even if it's a GP location. There are some hospitals that you might be able to see rehabilitation. There's lots of stuff, but get a feel for that. They might work with exotics. Also get a feel for too, if you want to be at a GP location, like a general practice, or if you want to be at a specialty location where there's all different types of services that you'll get exposed to, completely different. And I suspect that probably your school is asking you to focus on particular skills, so that will help with that too. But I guess the point of this is just to really go into this conversation with an idea of what you need to know from them, and making sure that they understand that you're organized and you know what you need. Okay, any questions about the externship stuff?
I don't see any questions. I'll just make a note just if there's any confusion. So we call them preceptorships. VCA calls them externships.
Yes, I'm
You
sorry.
might
That's
see-
true.
It's fine. It's fine. I'm just pointing it out in case there is confusion and nobody's asking. So different places just use different terms for it. They use
Yeah.
It's the same
I'm
thing.
so glad you said that, because you and I think Canton use that term, preceptorship. But yes, same thing. It's exactly the same thing. And the cool thing is too, you do get paid as an extern, because Delhi has agreed to pay you, have you get paid, which is wonderful. So when you're doing your externship, you will be paid for those hours, which is awesome. Okay, if you do have questions about externships, again, don't hesitate to reach out to me and Lauren afterwards. We can definitely help with that, but we try to make it pretty smooth. The goal is we don't want you to feel like you're, you know, begging someone to give you a call back or email you back. We want you to get placed and feel comfortable that you know where you're going. All right, after you graduate, lots of options. I have to say, like, once you graduate, schedule sitting for the VTNE right away. Your brain is so full of all that good stuff. Take the exam while you're fresh and you just graduated. I would recommend that for sure. But once you get your LVT, you know, you are going to be pursued. Like, you're going to have so many options. It is hard to find an LVT in New York. It's hard to find one. It's, you know, we need more of them out there. So you will not have a hard time getting a job at all. And there's a lot of different places that you can go with your degree. This is just a few of them. I personally went into GP and I only did specialty as a second job, which I hope you guys don't ever have to do. But yeah, but there's lots, and Lauren will talk to you about her journey, which was in specialty. But there is lots of things you can do. And, once you get a couple years under your belt, there are some additional options. Leadership positions could happen kind of accidentally like they did for me, or you could pursue them. Industry positions too. There are a lot of industries are like looking like oh God, my brain just went. It basically working in a sales capacity, they are looking for someone with a background. Typically, they want someone with a bachelor's degree who has worked a couple years in the field, but that is definitely definitely an option out there too. And I mean, this is kind of, you guys know this. There's two general types of locations, GP and specialty. VCA does have urgent care, and there's some other companies that have it too. That's a little bit different. It's more of you're doing a lot of customer service in that type of model. But again, it kind of just comes down to what you're the most excited about. And that the first couple years are really just learning and being really open to kind of accepting that you have a lot to grow, and be patient with yourself, give yourself some time to learn how to truly be the intuitive technician that you'll ultimately be. But yeah, again, I said most of my experience is in GP, but I have a splash of ER, which is nice. I actually worked at a hybrid practice, which did we were 24 hours, so lots of ER, but it wasn't not in a specialty location. And you guys probably know this, there's all kinds of advanced designations you can get as a technician, which is amazing. I'm trying to remember when I graduated. I don't know how much of this there was. There may have been, but it certainly was not on my radar. But there's lots of things you can do. So you can continue once you get like your basics as a tech and you really feel comfortable. Then I think for specialties, you have to have at least 3 years of experience to start pursuing that. But you can kind of lean into the stuff that you love the most and get your advanced designation as one of the many VTS specialties that there are. If you do that, often there's a teaching component to what you're doing. So if you really love to mentor people, that would be something to consider. If you love critical care, or if you're really into anesthesia, getting those designations not only gives you more knowledge, but you can also be in more of a teaching position, which is great. I mentioned the CVPM. That is certainly an option too. A lot of times techs become managers, and I work with a lot of hospital managers that are also CVT, LVT, RVTs. So it is a very common progression in vet med. So if you were going to get into a leadership role, there are other resources, not just the VHMA, that can help you understand the stuff that isn't medical. So CVPM is one of them, but there's lots of things you can do to kind of support yourself. When you're in private practice, there are lots of positions within the hospital that you can kind of grow into. It kind of depends on the size of the practice. Some of them could be you're in charge of new employee training, or you are in charge of taking care of any of the externs that come in. Ultimately, it could lead to things like department heads or team lead, or you're in charge of I oversee everyone that's in appointments that day. When you're part of a larger group like VCA, or there's lots of corporate entities out there, there are some additional options available. So field positions are often where our technicians find themselves, and they can have a region of hospitals that they work with, and they train and they mentor. Again, Lauren will talk more about this because that's her background. And there are some even remote positions that often people, when they get many years into their degree, they want to do something that might be a little less taxing on the body, And I can't say there's a ton out there, but there are remote positions. And that's where you kind of are able to lean into all of the knowledge you have for many years and bring people who are just starting their career in vet med. But it could be lots of things. It could be ER hotline responder. But my point is that's kind of one of the cool differences between a private practice and a corporately owned practice is that you're able to have different types of options. I would love to, I can't really speak to any of this personally, but these are lots of the companies and the types of industries out there that are also looking for technicians. Obviously talent acquisition, that's what me and Lauren do, but you know, being someone that goes around and does the AHA accreditation inspections. It's something I looked into at one point. Obviously, again, working in a sales capacity or even just being able to utilize your medical knowledge in a position that is Trupanion, which, you know, is insurance, or even fear-free, which is may something that you would get exposed to at VCA, but most locations are starting to embrace those techniques. But there's lots of things you can do. That's the point of this. And again, in addition, there's even more things on top of that. So again, when I graduated, I think you could be in large animal, small animal, or research. And that was really it. Like there wasn't a lot that you could dive into. And it's so cool to see how much the field has changed since then. But there's so much that you can do. So it really is just figuring out what you love and being patient with yourself. Don't put pressure on yourself, but challenge yourself. You know, if someone gives you an opportunity, even if you're not 100% sure that you'll love it, give it a try. You know, see what is gonna end up being the next step for you. And you can always take a different step. You can always pivot. So that's what's so beautiful about all the different options within vet med is you can kind of take your time to figure out what really is gratifying to you and what puts a smile on your face every day. So make sure you push yourself a little bit, but trust your gut. And if you love something, lean into it and know that you have so much opportunity because you're going to have that LVT after your name and you're going to be sought after. So don't settle for being in an environment that doesn't make you happy. There's too much good stuff out there. Okay. Any questions about any of that?
Oh, we're good.
Okay, so I'm going to hand it over to Lauren.
Sorry, I forgot I have to unmute, right? Years of virtual meetings, years of them, and I just assume the computer will know what I need. So super cool. Hi, students. I'm Lauren. I'm the other half of the presentation, and this is my vet med journey. So vet med is my second career. I wish I could say I've been in vet med for 30 years since I started at 14 in the kennel volunteering. That's just not how my life worked out. I always loved animals, of course, right, like everybody else. But I chose the first job, and that was business and sales. And then you're all too young, but the market crashed like twice, and I was downsized, and I was on unemployment, right? And like doing that self-reflecting, what do I want to do with my life? I was living in Queens at the time. And so, I had my pity bull, my heart dog. And I was like, well, okay, right. I started, doing the Google, found LaGuardia Community College and was like, I could be a veterinary nurse. Yes. So I went back to school, took my tush on the bus every single day to LaGuardia. And then here we are. So let me see. I guess my career. So graduated LaGuardia. I started basically right into specialty medicine. I am an energetic lady. And so I was like busy. So started in specialty full-time in the surgery department. I was a baby anesthesia technician. So that was super cool. And I would put myself in every surgery, right? Like if my surgery wasn't going, I was following the next technician into their thoracotomy. I was following the next technician into their liver lobectomy. You know, like I wanted to know more about anesthesia. I wanted to do my job well. And looking back, I mean, a lot of vet med wants to be trained, right? But a lot of it, you have to put yourself in those situations, right? Find your mentors, etc. Anyway, I digress. So, baby anesthesia technician. Then I started working for VCA. I started working in the ICU and on the ER, which is really cool. I started doing some swing shifts. I fell in love with the ER. So like initially I thought I was going to be a surgery and anesthesia technician and I was going to be the best one there is. But you know, life changes and plans change, and lucky thing we can flex with our jobs. So, you know, I had some kiddos, I had some babies. So childcare became a thing, right? Like how can I afford this? I'm a vet tech. So I started working swings. So it's, you know, less in the day, you need coverage, less time. And then I fell in love with emergency medicine. I was like, this is where this energetic bing bong brain needs to be, right? So, so I did that with VCA for a long time. I left for a little bit to become like a supervisor, gain some leadership experience. I came back with VCA. I started as a career development coordinator, which is kind of bananas. So I was supporting all the specialty hospitals in the Northeast, right? So here I am, I'm a technician. And now here I am, I'm a technician, and they're putting me on airplanes and they're flying me to Michigan and Ohio. And I'm living my best life with my suitcase in the back of my car, showing up at these specialty hospitals, right? Helping support the medicine, helping to support the supervisors, doing educational evaluations, like super cool. From there, my position rolled and I became a regional technician director, which is bananas, right? Never imagined this in my life. So supporting the medicine just from a higher level. I started working, we have, like VCA is national, right? So we have a medical operations department. So I was working on a national level, contributing to their continuing education events, essentially, right? If you join VCA, you have access to WOOF University online. So we offer a ton of free continuing education. So I was one of those people behind the scenes, you know, getting the speakers, getting the paperwork, doing all the things, setting up the event, being the MC. Like, who would have imagined that, right? One day you're setting up rooms and giving vaccines, and the next day you're running national programs. Like, what? Cool. And then, so I mentioned I had some kiddos, and so life moves pretty fast. And all of a sudden, you need to be home more, right? I was traveling full time. I think I was up to 80% on the road. And, you know, I have a family, you have to be there to support the kiddos. They need things too. So, you know, looking into VCA, it's still, right, still an employee with VCA. I was like, what else can I do? How can I pivot again to support my family, but also satisfy my own career goals? And I found recruiting, talent acquisition. You know, Marianne's been my support this whole time, right? You find your mentors, you find your people. And so then here I am supporting you guys. So now I'm going to talk to you a little bit about kind of how to assimilate, right? How to go from being a student into your externship or a student into your full-time hospital role. Yeah, cool. So like I said, I am a lot of person and no one taught me how to be a professional. I just had to learn many bumps along the way, how to, you know, I don't know, be a professional, right? Be an adult, Lauren, be an adult. So I used to start my Mondays, like I said, I'm a lot, right? So I'm like, hey, let's work. How you doing? What are you doing? How's your weekend? I'm the guy on the top, right? On a Monday. That nobody wants to see that guy on a Monday, right? Right? And or like when you come to work, are you that guy on the bottom? Oh, it's Monday, right? Are you that potato? Nobody wants that either, right? Because you don't want to bring everybody down. So like what I'm saying is your behavior speaks volumes. When you show up to your hospital, you are bringing your professional self. Hey, good morning, so-and-so. Hello, Miss Receptionist. Hi, doctor, who's a what? You know, and let's work together as a team and move through our day, right? Be open and talkative, but don't be a freight train or a potato. When I say veterinary team, your ability to communicate professionally with your coworkers will take time, but forming these good working relationships is so important. So, I mean, that just takes time, right? Like when you have interpersonal conflicts or things like that, again, professional conversations. And what I'm saying also, veterinary team, you are going to be a graduated, right, licensed veterinary technician. Super cool. You just have to remember that no one job is more important than the next. Okay, so if there's a phone still ringing, you got to answer it, right? If there's some poop on the floor and all the technician assistants are busy, you're grabbing the poop, right? If someone's got to take a walk, you're taking them. If you need, anything needs a scrub down or a deep clean, you're doing it, right? You are a team working with your friends. Pull some trashes, right? Don't just stand still. Help, okay? Leave it at the door. This is so important too. Everybody is going through something. Everybody's got a thing, right? Everybody had something happen on the weekend, or something with a family member, or something with your boyfriend, or your relationship, or your bills, or your life, right? There's all these outside factors. But again, you are the professional. You need to be able to show up at your job and separate your personal life from how you are going to help these patients today. Okay, this is called adulting. It's hard to do. That's it. So you're on shift. Like I said, I worked mostly 24/7 hospitals. I did some time in GP, but this meme is exactly true, right? Trying to explain today's shift, what happened to the night shift. Ugh. So professionalism, shift etiquette, right? If you're on time, you're late. If your shift starts at 8 a.m., we need you there at 8 a.m., right? We need you there at 7:45, actually ready to go. This is not you show up with your Dunkin' and your glasses on and it's 8:05, but you still didn't punch in, you still didn't change your scrubs, you still got the wrong shoes on. Oh, hang on, I need a couple minutes for breakfast. I'll be right out. It's 8:15, it's 8:20. No, I don't think so, right? Your shift starts at 8. You need to be there before 8 to get all your tchotchke stuff done to then come to work, right? Especially when I'm saying in these 24/7 hospitals, you're relieving the overnighters, okay? So if you're having an overnighter stay later, people are going to know that. People are going to say, I don't know about this new guy. I don't know about it, right? These overnighters are changing their own circadian rhythm in order to be working awake at night, right? So now it's their time to round, it's your time to work. Part of this is when your teams are rounding, even in the morning, general practice or specialty, pay attention, right? Rounding is when everybody comes together for the morning, or it's like that morning meeting or huddle, and we're gonna talk about the day. Hey team, this is what we're doing for the day. If you're around, don't be like me. So I was a baby surgery tech. So when we would be rounding in the ER and going through all the patients and what they need, I was passing notes. I was like, no, what did you do for the weekend? Instead of taking notes on any of the patients, right? And this is terrible because then later on, here's baby surgery tech Lauren, and then the ER case gets transferred to surgery because it's a foreign body. And what do I know about the case? Nothing, because I was passing notes. Yeah, this happened more than once. But like, you need to know, right? Did this dog, when was the last time it took a walk? Okay, because this is important, right? If they have to urinate or defecate, what's it going to do to their heart rate before I'm putting them in surgery? When's the last time this patient had pain meds? Did this patient have pain meds? Was he NPO? I don't know. What was on his blood work? Is he anemic? I don't know. Has he had Serenia? I don't know, because I was passing notes. Don't do that. What else do I have to tell you? Oh, not only that, my friends, the stuff you can learn, right? You guys are new. There is so much to learn being said, right? From case to case to case on every patient, on every hospital. You're going to learn from internal medicine patients. You're going to learn from those overnight nurses. You might learn a ton of tricks and tips about just how to behave for certain cases. It's just an opportunity not to miss. So please make sure you're paying attention during rounding and show up early is actually on time. Okay. Okay. So the right way to ask a question. Again, I said right, I am a freight train. I am a lot of woman and I'm a direct communicator. So this was difficult for me starting in a new profession, starting in a new field. Like I want to know what, where, when, who, why. But the way you come across is super important, okay? So what do I tell you? Okay, okay, when do you ask a question, right? Is it in the middle of a critical procedure? Is it like when all these pumps are beeping and that nurse is counting and doing math and doing pumps and checking a patient, that is not the time, right? They're clearly busy. So always wait for a pause in momentum, a pause in the day. How you ask a question, right? Like I was saying, tone, volume, this is all super important. So for example, if you're working on a team, you're working in the ER, and you say to the doctor, "Hey, why did you use cefazolin on this patient?" At my last practice, we would always use amoxicillin. Okay, cool. So first, nobody at your current hospital wants to hear about what you used to do or what your old clinic did. We don't care, right? It's called practicing medicine, right? Everybody practices differently. So also, when you say, "Hey, why are you using cefazolin?" Sometimes, like for people like me who are a quick talker, that can come out kind of aggressive. Why? Like I'm questioning the doctor. Why? Even though I'm not, right? It comes from a good place. I really honestly just want to know. So the best way to ask a question that has taken me through my entire career is, can you help me understand? Right? Write that down. Can you help me understand why we chose cefazolin in this situation? Oh yeah, totally, absolutely. It's a broad spectrum antibiotic and yada, yada, yada. For those reasons, right? Can you help me understand? Like I said, pause in momentum. That is that. So first of all, I love this. It's okay to respectfully disagree. This kitty, first of all, no. Second of all, no. You guys are graduating from an excellent program. You're going to be well trained, full of knowledge, ready to go. But like I said, it's okay to respectfully disagree. So in a professional manner. So if you're asked to perform a procedure that maybe you're not ready for, right? But maybe the team thinks you are because we're busy, we're bumping, we're shorthanded. Hey, Lauren, can you get a cysto on that dog? Okay, so a cystocentesis, can I get a sterile urine sample on that dog? No, right? So you're nervous to do it first by yourself. Maybe you've done it before, but you can definitely say, hey, I don't think I've had enough practice with that yet. Is there a seasoned technician that can be my second or that can do this with me, right? I don't think I've had enough practice yet. Can I have support during that procedure? Yeah, totally. Yes. I have trained a ton of externs in my life, right? And what the worst thing to do is if you're asked to help with a procedure, don't disappear, right? Like, okay, maybe you're nervous. I totally get that, but don't disappear, right? You still want to express the fact that you're interested in learning, right? Yes, I'm interested in doing this. I want to be a part of this, but I'm not ready to do this alone. Same thing goes for anesthesia. Same thing goes for maybe sedated radiographs, right? Like anything that you just don't feel ready for, please always ask for support or backup. When your gut is saying no, right? This is totally all okay. No matter what's going on, right? We want patient safety first. It's not about time. It's not about getting something done super, super fast. Like I know we're busy and there'll be a wait. There'll always be a wait. This is vet med, right? Make sure you are ready and comfortable to perform the procedure. Cool. This is one of my favorite slides too, right? Put the work in. You're a veterinary professional, okay? You are about to enter a multi-generational workplace. So being confident, yes, being confident in what you know, but also be coachable, okay? Veterinary medicine is the practice of medicine. You don't know everything. I don't know everything, right? Be open to new ideas or new ways to get to the same end result, okay? So I always say that I have zero talent. I have none. I have zero. But what I do have is everything on this list. Like this is how I've gotten so far in my life is I do this, right? I'm on time. We talked about that, right? I'm showing up. I'm ready to work. Let's do this, right? Work ethic. This is me, especially when you're the new guy and you're in the hospital, you want to know all the things. Put yourself in those situations. Put the work in. Yes, I can do all these things. Don't just stand around holding up a counter for a little while doing nothing. You can stand up at counter in, you can hold up a counter in the surgery suite, learning anesthesia. That's a good thing to do. Effort, right? What are you going to do today? Body language. This is so important too. You are a professional. So I know you can't see a lot of me, but like when you're walking in the room, you're crossing your arms. Meh, meh, meh. That doesn't look friendly. That doesn't look inviting. If I'm crossing my arms when I'm rounding, it's often I will say, oh, I'm cold. It's chilly in here. Brr. I want people to know that I'm still approachable. I am really just a cold human. That's how I roll. Make sure your energy is good, right? Like, again, are you walking in like that potato? Do you have a positive attitude? Yes, I do, actually, right? And I'm gonna make sure that this is a good work day for everybody I work with. I'm passionate about what I do. I am coachable. Right? Am I doing this right? Can I do this better? Doing extra. You want to learn, so you pick up those extra shifts, or you stay a little late, or you help out. Just help, right? If you're not busy and your hands aren't full, odds are someone else in vet med needs you to help them hold their dog, right? There's an ultrasound happening. There's 4 legs there. There's something to hold on to, right? Maybe there's radiographs happening. Maybe there's a cardiology appointment that needs a hand, being prepared. This is so important. Okay, ready? You're a veterinary professional. So when you come to work, when you come to your externship, there's like 4 things you need, okay? You need your watch. You need a watch. Or a timekeeper of sorts on your stethoscope, because there's not always a clock in every hospital. Okay, so something with the seconds. My watch for work straight up doesn't work. It's always on the wrong. I don't know if it's daytime savings or daylight, whatever. I don't know, but the seconds work, and that's all that matters. So bring your stethoscope. You cannot be an extern without some ears to hear the things. This has happened to me when I'm betraying externs. Okay, go get that triage. We're gonna work on a TPR. Temperature, pulse rate, respiration, right? Cool. They don't have a stethoscope. Okay. Day one, watch, stethoscope, bring a pen. That's cool. Bring a notepad. Because remember when I was saying, when is the right time to ask a question? My brain is always going bing, 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 but it also forgets stuff right out the other side. So I'm always writing it down. Write down the question, write down the list, write down the orders, write down what you have to do. You can go back to it later. Also, for extra, it's always sweet to have your own pair of scissors, your own pair of hemostats. Trying to undo lines, you always need something. But watch, stethoscope. Oh my gosh, last part, being prepared. Make sure your scrubs fit. You are a veterinary professional. I don't need to see your plumber's crack or your Victoria's Secrets. Okay, I just don't. It's been too many years of seeing people's underwear and butt crack. This is important, right? Because you're a professional. We all got to bend down and pick up dogs. They make shirts that you can tuck in that go under your scrubs. They make cute scrubs that actually fit and tie better than those old school ones that are like Marianne was saying, the unisex kind that are ridiculous. So please make sure your clothes, your hair, you are coming to work. Cool. Practicing medicine, right? Oh, I love this, right? Petting the dog, petting central, fuzzy butt, rub here, not here. What does it mean to practice? So it means you're learning. You are learning vet med and you need time, right? At times you're going to forget, you're going to get overwhelmed, and you're going to make mistakes, okay? But being a professional is how you handle those mistakes, okay? It's your integrity, right? When a mistake happens, what are you going to do? When a medical error happens, how do you respond? Put your big girl scrubs on and own it, okay? If you you make a medical error, quick, figure out what you did, right? Get your supervisor, get the surgeon, get it who's ever on the case to say, this is what I did. Oh my God, how do I fix it? And then even if you're gonna get documented, even if you're gonna get written up, because we're here for patients first, right? I've made many mistakes in my career. I told you I was a baby surgery tech, right? So baby surgery tech knows baby surgery tech things. And here I am picking up ER shifts on Sundays because I'm also a poor technician. So I need the extra income. And so when you put a surgery tech in the ER, it doesn't always mix. And so I was like running sheets and reading the things. And I started bolusing fluids on this patient because their blood pressure was low. I got an order for a bolus. I dropped the bolus. I didn't think to look that there was potassium in the bag. Because when you're in surgery, is there ever potassium in a surgery bag? No. So this guy's KCL was a little off, right, in the ER. And what's so bad about bolusing potassium? Yeah, I could have killed him. Oh, okay, but I didn't. Yay, because I also had a very seasoned technician on with me, and she stopped the bulls immediately and was like, "Hey, Lauren, let's learn from this situation." And I did immediately, scarred for life, but never forgot it, right? So you learn, you evolve. So be patient. Be patient. Mistakes will happen. I mean, I've bolused metronidazole too quickly. I've grabbed the wrong bottle of Baytril off the shelf and didn't dilute it enough and perhaps caused a seizure. You'll learn this. You'll learn this over time, right? There's different kinds of Baytril. If you're using the highly concentrated one, et cetera, all these animals are fine. Also, I've been practicing for a long time. So, but not to scare you, these are the biggest ones I've made. But I also learned from them, right? And I fixed them and I spoke to who I needed to speak to because you own those mistakes. Like I said, be patient with yourself. And remember your why, right? So you're going to have these long days, 12-hour shifts, 14-hour shifts. You're dealing with the people and you're dealing with the animals, and the people are bananas, and sometimes the animals are bananas, and sometimes your coworkers are bananas. And it's just hard some days. And you're like, why am I in vet med getting paid? Cool. Okay. But then you have those moments, right? You remember your why and you move forward. Oh, I love this guy too. I have no idea what I'm doing. That's my daily basis. I have no idea what I'm doing. But then I go back to my 10 reasons, right, that require zero talent, and I get back in there. So you're credentialed, now what? Is exactly, right? Is like learning doesn't stop after the VTNE. So when I was a baby tech, I passed my VTNE and I sold all of my books immediately. Goodbye, veterinary medicine, right? Hello, professional. And then 5 years later, when I was on the ER, I was like, oh yeah, I want to specialize in critical care. I want my VTS. I want to do this. And turns out you're going to need a lot of those books that you started with. So I had to repurchase them with my continuing education money that was provided to me by VCA. Thanks so much. But still, I had to rebuy all the books that, anyway, don't sell your books right away. You might need them. Throughout your career as a professional, find a mentor, okay? Find a mentor. So a mentor is not necessarily a friend at first. A mentor is someone professionally who you can look up to, right? Who you can aspire to be. Are they very good at their job? Are they a very good human, right? Are they comfortable with you asking them questions? Are they truly looking out for your benefit? These mentors, you find them throughout your career and they can help shape and guide you into being a more successful you, okay? And you need that in vet med, right? Because there's a lot going on. You always need to learn from the nurses before you. And again, it's okay not to know. It's okay. Like, don't make it up. Don't lie about it. Don't try to pretend. It's okay. We're professionals. You're going to forget stuff. You can just ask. Hey, oh, I don't remember that. Tell me again. Well, what's the dilution of so-and-so, or, you know, whatever the question. This is medicine. It's okay to not know.
Great, we have like 1 minute left, Lauren.
Oh, super cool. Okay, this is then the last part is, you know, work-life balance as a professional is plan your time accordingly, right? Find that work-life balance. You know, through VCA, we have the Better Together Fund. We have Headspace, which is like a meditation app. We have social workers in our specialty hospitals. So make sure you're taking care of yourself. You're laughing more, right? We do some weird stuff in vet med. So make sure you're laughing, you're having a good time, and you're taking care of yourself, okay? Sorry, we had to cut it short. If you guys have any questions, please reach out to Marianne and I. You have our emails, perhaps, or we will email you if you've registered for the class through the QR code. We will email you a thank you with our contact information.
Great, thank you so much. Oh, we do have one question, if you can hang on for a minute.
Yeah.
I don't know if you want to stop sharing, Marianne.
I am gonna try. Yeah.
I think the student is just gonna come back
Okay.
here. Oh, what happened? Gallery. There we go.
Hi,
Hey.
I have a quick question regarding okay, so earlier you mentioned that you guys could help with confirming placement and such of the preceptorship sites. My question to you guys is, how do you guys work with Access VR to do that if, in the case that someone works with Access VR?
I'm not sure what Access VR is. What is that?
Is that, I mean, it's not a VCA location.
So Access VR is it's a program that helps people with disabilities in locating placement of jobs or
Oh,
internship,
sure.
like other career skills.
Sure. You know, I can find out for you. I think it would still be the same process, but if you, yeah, I can find out if there's something additional that is done. Yeah. What's your name? So I can follow up with you.
Catherine Wright?
And did you already fill out an externship application or just not yet? Just looking for a question?
Just not yet. I do have a place that approved for me to go there. I just need to send them the paperwork and stuff.
Oh, cool, cool, cool. We'll find out for you and we'll email you back.
Okay, thank
Yeah,
you so much.
That's a great question though. Thank you.
Thank you.
Cool.
Thank you.
Yeah, we'll see you.
Okay, guys. So we'll see you later.
Okay, I will see you at noon.
Okay. Bye-bye.
Bye.